So I want to talk a little bit about the future of market research. And we've seen a lot of great presentations yesterday that looked at some of the possibilities. What we do for a living allows us, our clients, our companies to make good changes. It gives us the courage to make change. And if that wasn't a part of my job, I don't think I would enjoy getting up every day. This is from Rob Atencio from Pfizer at last year's market research event in Boca Raton, Florida. And this is a very poetic statement. Insights also give us the knowledge to know which change to make, or at least to recognize Susanna, to have an opinion about which change to make. Now I want to talk a little bit about how we go about this. This is basically the scientific method. There's arguments and, there's small arguments here and there. And I am not going to be teaching you about the scientific method. But I want to bring this up as how we think about what we do to provide insights, to gain knowledge moving forward. This is, we'll come back to this in just a minute. I want to set a couple of examples up about how things are changing by talking about the hypothesis. Right now, and generally speaking, we go out with some kind of study, some kind of effort, and we test one or two hypotheses. With a really good experimental design, we test 10 or 12 hypotheses. With a good experimental design and some choice models, we may test 100 hypotheses. We're going to look at how that's changing. I'm going to talk about two examples that come out of the medical field. And I'm doing this as a proxy. It's a very conservative field, and the answers have to be accurate because people's lives are at stake. Fortunately for most of us, people's lives are not at stake. Proteins. Proteins are an important component in how our bodies function. There are a total of 20 amino acids that exist in our body, and proteins are made up of these amino acids. They hold hands in a line. And the smallest protein in the human body is 75 amino acids. The largest is 350,000 amino acids. It's called Titin. They grab together, and they start folding in on one another. Like a rubber band, when you twist it, it folds and folds until it gets into a stable shape. And depending on the order of those amino acids, it's a different way of folding. The smallest example that I gave you with 75 amino acids has 200 degrees of freedom in the number of options that it has to fold. I didn't calculate what Titin, the degrees of freedom for Titin, but the number of ways that it can fold is astronomical. In the past 10 years, there's been a lot of advances because of the computer systems that can fold these things. But it's really like a puzzle. It has to fit. So there needs to be a human element in understanding how one protein fits to another. The important part of this is that how proteins fit together and how they fold are important for therapies for cancer, AIDS, Alzheimer's, and if you went to the research club meeting last night, it's also important for discovering a hangover cure. Foldit.com. This is how we are approaching understanding how proteins fold. It's a game. There are thousands of players, there's teams, there's individuals. And they're all working on different aspects of how proteins fold. The results of Foldit.com, this game, have been published in the Journal of Nature, the National Academy of Sciences, among many others. They are making progress in understanding how proteins fold because of a game. People are playing this game because it could be fun to play. People are playing this game because someone that they know has Alzheimer's, has cancer. They want to make a difference. There's people that are playing this game for generally the social good. They are testing millions upon millions upon millions of hypotheses because of this game. And we're making progress because of this game. The next example is drug interaction effects. There are approximately 150,000 drug prescription compounds that have been approved by the Food and Drug Administration in the United States. Each one of those drugs has to go through a set of tests to make sure that it is safe and effective. They also have to go through a series of tests to make sure that certain combinations that they might expect of these compounds are also safe and effective. But they don't have to go through testing on combinations of every one of those 150,000 prescription compounds that someone could be taking. So how do we learn about the drug interaction effects that could be happening? The way it happens today is a patient goes into their doctor for a visit, complains of some issue or some issue is identified in testing. The doctor talks to them about the prescriptions that they're taking. They make notes. In the adverse effects reporting system, over a period of time, there's enough frequency or enough severity about these interactions that the FDA says it's a real side effect. This is a long process. For uncommon combinations, this can be years and years. Let's look at an alternative. There is a panel of 6 million people that have raised their hand and said, you can look at my search history. I'm okay with that. So a team from Stanford, Columbia, and Microsoft got together and started saying, let's see if we can improve the process. They looked at people's search history. They could identify those that were probably on an antidepressant. In this particular case, it's Paxil. Also a cholesterol-lowering drug. And I forgot the name of it. It's a long word. They were also able to see those people that were likely on the antidepressant and likely on this cholesterol-lowering drug and identify, based on their search histories, that they also had high blood sugar. Once the experiment was designed, this was almost immediate. This was published just last month. The implication here is that the old way was slow. This way is much faster. However, we're also going to be able to test for a lot more drug interaction effects than the old system allows. We're able to test more and more hypotheses. What I'm saying here, the scientific method still exists. It absolutely does. The nature of how we address the scientific method is very different today than it was just a few years ago. The amount of information that we have at our hands, at our disposal, is very different. And we're looking for different ways to use this. Hypotheses, exploration, and testing in many cases are concurrent. Data collection is different than it has been. We have the data in our hands in many cases. So it's taking the data that exists from listening, from observations, and working with that data, asking where we have to. At the end of the day, we still accept or reject what we have to do, the decisions that we have to make. Today, this is our common form of gathering information. Surveys, focus groups, we do a lot of that. We've seen new and better ways of doing that. Listening is growing, passive listening. We have social media data. We have customer comments, all kinds of things along those lines. I actually got ahead of myself, so I apologize. We'll come back to that. And today, sometimes we observe. There are mystery shoppers. There's ethnography. The future, it's the same three things. But it's in a different priority. It's in a different order. Listen, passive listening. Huge amounts of opportunity. We have ratings. We have reviews. We have social media of all kinds, Facebook likes, Twitter, you name it. We also have the same things that we have had before, customer comments, for example. Observe. Biomarketing, neuromarketing, those things that we can watch people with. We have data from mobile, geolocation data. We have data aggregators that are watching our transactions. There are a number of those in the US, Equifax, Axiom are a couple of those. We have other companies that are pulling together information about us as consumers in different ways. We have ethnography still, but we also have mobile ethnography. Ask. We don't have to ask as much. It's that simple because we have all of these other things. Ask is still very important. It's important in a number of situations. It's just not as dominant as it once was. When we do have to ask, we have to think about the anytime, anywhere consumer. We have to think about engagement in a way that we haven't had to, and we've seen some wonderful examples over the course of the past day. And the thing that I want to say about this is it needs to be engaging. Engaging does not necessarily mean fun. We saw Foldit.com. It is a game. If you like puzzles, it's fun. But it can be engaging because of a personal connection. It can be engaging because of the social construct that it lives in. People wanting to do social good, the interconnectedness. There are a lot of ways to make asking more engaging, and that's the way that I see the future of marketing research. Obrigado. The other phrase that I know in Portuguese.